Molly, starting today, residents of Indiana, Iowa, Nebraska, Utah, and West Virginia who receive government help for groceries will see some new restrictions. These new limits are being imposed on junk food like candy and sodas as part of the Make America Healthy Again push. Let's bring in Dr. Hooman Hamati, board-certified MD and PhD research scientist. Doctor, good morning. Happy New Year.
Happy New Year to you, Mike. Thanks for having me.
I would like to start with the FDA Deputy Commissioner for Human Foods, and then I'll get you to weigh in.
We finally have an administration in place that's willing to tackle these big problems. It's going to start with the dietary guidelines for Americans. They touch things like school reform, school lunches, WIC, SNAP reform, and a number of other federal programs. And really what Secretary Kennedy and this administration wants to do with the dietary guidelines is return to common sense.
Do you support this effort to stamp out junk food?
100%, Mike. Under Secretary Kennedy and FDA Commissioner McCary and so many others in the administration, there's been a renewed focus on keeping Americans healthy, making Americans more healthy by recommending and actually helping to fund foods that are healthy. This is common sense, like he said in the clip you just played. Right now, for food stamps, for SNAP benefits, the #1 expenditure is soft drinks, sugary sodas. Number 4 is bagged snacks. Number 11 is candy. Why are we funding things with food stamps that are not food? Yes, they're fun, but we may as well be paying for cigarettes and alcohol. It's not right. And in fact, it's making Americans far more healthy. I worked in East Baltimore, Johns Hopkins, when I was in residency. I had a large proportion of my patients as young as 30 who were going blind from diabetes, who needed amputations. This isn't right. We must at the same time address the fact that many poor Americans live in food deserts where there is no access to good, healthy food. So I think the administration would really benefit people in this public health crisis by making food that's healthy available in those inner city and rural communities just as much as they're withdrawing support from paying for food stamps money for unhealthy foods. And I think if we do a dual-pronged approach, we can dramatically improve public health.
All right. The flu is surging. According to the CDC, there are 32 states and jurisdictions such as New York City, Washington, D.C., South Carolina, and Louisiana showing high or very high levels of flu. Doctor, what should we do?
Well, first of all, this does not come as any surprise, Mike. As we know, flu is seasonal and it does tend to surge this time of year. That said, what can we do? And we now know from COVID what works and what doesn't work, right? First, if you're sick, don't leave the house. It doesn't matter whether you have the flu or cold or COVID or something else. If you're feeling sick, if you have body aches, chills, fevers, upper respiratory infection, why go and infect other people? Second, if you're at a high-risk group or if you want to be sure that you're protected, talk to your doctor about a vaccination, right? For many people, the flu shot actually can be very beneficial. Why not go and consider that for those people who could potentially benefit from it? Many do. And in fact, for the elderly groups, the risk benefit is very, very positive and favorable. Finally, there are people who, if they are feeling a little sick and want to go out in public, feel free to mask up if you want. It could benefit people around you if you're not coughing in their face. Personally, I tend to stay home when I'm sick, and I try not to go and infect other people, but sometimes you don't have a choice but to leave home, especially when it's the holiday time. I understand.
Good advice. The week of December 20th, there was a spike in percentage of positive influenza tests, 25.63%. Does that surprise you?
It doesn't, only because at any given point in time, we have different types of respiratory infections that comprise the infections that the overall population has. And so at certain months, the flu will be a lower percentage. Others, the flu will be a much higher percentage. We're just reaching that time of year when seasonally the flu will be a higher percentage of those people who come in with those very similar types of respiratory complaints. And I think it's normal. We see it every year. Emergency rooms become full of people. Hospitals become full, especially of elderly and high-risk people who are sick with flu. And really, it's just a reminder to us that we should try to avoid getting those around us sick if we possibly can.
All right. Great advice there, Dr. Hooman Hamati. Thank you so much for your time today, sir.
Thank you.
Hey, it's Will Cain. Click here to subscribe to the Fox News channel on YouTube. It's the best way to get our latest interviews and highlights. And click to subscribe to the Will Cain podcast for full episodes right now.